Thank you for honoring this invitation to join this event on YouTube. My name is Pharmacist Okon. This is Wellness and Academic Beyond Boundaries. The aim is to ensure that you live healthy. Today I will be considering the safety of painkillers in pregnancy. Let me tell you that during pregnancy, women go through a lot of pains. In the morning, at night, even at noon, they go through a lot. So they may want to seek comfort, and by so doing, they may want to take painkillers. And some of them may not want to go to the clinic or to the pharmacy to be properly guided. They get these painkillers at a very cheaper rate from roadside. This is very bad because at there they might not be properly guided, counseled, instructed on what to do. But if you go to either a clinic or a pharmacy, they will be guided, properly instructed on what to do. So let's talk about NZs now. Okay, we'll be considering NZs, opioids, and others. Let's go to NZs. The only painkiller that is safe in pregnancy is at all weeks. All the weeks is paracetamol. Taking NZs like ibuprofen, aspirin, and the rest at 20 weeks and above have been linked to several conditions. Example, renal impairment in the unborn child. So, at 20 weeks and above, you are advised to avoid painkillers if you are pregnant. Avoid painkillers at this time, but if you must take it, it is advisable that the dose be reduced to the lowest dose and the shortest duration for the treatment, 24 to 48 hours. Beyond this, you are to be monitored closely. Now, at 30 weeks of gestational age, painkillers, NZs are contraindicated. You should not take any NZs from 30 weeks gestational age. From 7th month and above, that's the third trimester. The use of painkillers in third trimester is contraindicated. Don't use them. Why? Because of the risk of premature closure of fetal ductus arteriosus. Taking NZs, ibuprofen, diclofenac, aspirin, and the rest at 30 weeks of gestational age is linked to the premature closure of fetal ductus arteriosus. It's a blood vessels. So the negative effect of premature closure of this vessel can cause pulmonary fetal hypertension and subsequently heart failure. So though this vessel, the fetal ductus arteriosus, closes after delivery, all on NZs. Like I said, the use of NZs from 20 weeks and above is linked to renal impairment in the unborn child. Can also link to infertility, linked to delayed ejection of milk and stillbirth. Can also link to the premature closure of fetal ductus arteriosus. Like I said before, if painkillers, if NZs are to be used at 20 weeks and above, the doses should be reduced and the duration shortened to prevent what I just discussed. Data from animal studies have also suggested that the use of painkillers in pregnancy can delay ejection of milk. That means the woman can give birth and breast milk does not come out early. It has been linked to the taking of NZs. Delayed ejection of milk and stillbirth from animal studies, and that can be linked to humans. Another studies have also shown, still in animal data and in animal studies, that taking of NSAIDs can delay the rupture of ovarian follicle. Ovarian follicle is actually a sac filled with fluid that houses immature egg in the woman's ovary. So if NSAIDs are taken, prolonged use of NSAID can delay the rupture of this sac. Of course, this sac must be ruptured monthly. One of them that is mature must be ruptured to release the egg for ovulation. So imagine a situation where they are delayed or prevented from being ruptured. There is a greater chance of having infertility. So it is advisable that if you're a health worker watching me now, you should know that the women that are having difficulty conceiving, it is advisable to reduce or withdraw NSAIDs because it can delay or prevent the rupture of ovarian follicle. Can delay or prevent the rupture of ovarian follicle. So now, let me discuss opioid. Opioids are contraindicated in pregnancy. They are not to be used. Studies have shown that the prolonged use of opioid in pregnancy can cause dependence to the fetus. So immediately after birth, there's what we call fetal withdrawal syndrome. It can affect the child. That means while the woman was taking maybe codeine, morphine, or the rest, it was passing to the placenta to the fetus. So as the woman gives birth and the child doesn't get the smaller doses of those drugs again, it may lead to withdrawal syndrome, and that is bad. So avoid the use of opioid throughout pregnancy. So let's talk about the last one, which is neuropathic pains. It is known that pregnant women, not only pregnant women, everybody may at some point have neuropathic pains. Neuropathic pain can be caused by maybe diabetic neuropathy and the rest. So, how do you treat neuropathic pains in pregnancy? There are several drugs that are available for the treatment of neuropathic pains. But not in pregnancy. We have like amitriptyline, pregabalin, fencarmazepine, and the rest. In pregnancy, amitriptyline has been used in the treatment of neuropathic pain, but it is category C, meaning it can only be used when the benefit to the mother outweighs the risk. It means you should not use, or you only weigh the options. You should not use those drugs by yourself. Go to a hospital. Let the health personnel decide whether you should use or not. So as I want to end this video, I want to say to you, if you're watching me for the first time, that you should subscribe to this YouTube channel, can share this content for many people to see. And most importantly, please, if you are a pregnant woman watching this video, if you are single, man or woman, one day you will be a mother. Be guided properly. Avoid the use of painkillers in pregnancy. You can use a very cheap, very less amount of money to buy something that you cannot treat with millions. Imagine having a child that is deformed, having a child come to this world and suffer what he or she knows nothing about. Maybe because of your ignorance or your stubbornness. Please avoid the use of this pain. It's very cheap. Ibuprofen, I think some of them are 100 naira, 200 and the rest. If you use this continually, aspirin and the rest, if you use at higher dose almost every day at 30 weeks and above, you will have a very bad result. and this is not my prayer for you. It may not happen to everyone, but the issue is that how do you know whom it will happen to? You might say it cannot be me. That is when faith comes in. But science, your faith is good, but in science we talk about what we see, the data available. Taking NZ at 30 weeks of age have been linked to the premature closure of fetal ductal cirrhosis. You might pray that it should not be your portion. Yes, I also pray so. But don't you think it's better to prevent this from happening? If you go ahead with these things, if it happens, you may have to sell so many things to take care of your child. So my advice to you is to please consult your health worker to ensure that you're properly counseled. And when you are counseled, please adhere to the instructions. Every field has experts. Those that are counseling you are experts in their own field. You might be a professional in your own field. So accept what is given to you, read more, and be guided properly. Before I go, subscribe to this YouTube channel, share the content. The reason I'm asking you to subscribe is because this same week I will upload another one, and that will be on safety of antibiotics in pregnancy. I want to do video to ensure that women deliver safely and sound, because currently Nigeria is going through a lot. If we have more women that give birth to children with renal impairment, Nigeria will need to spend more money to take care of them. I doubt if there's any provision for that for them. So it's better that you take your destinies in your hands. Stop the use of painkillers. When you are pregnant, go to antenatal, register. If they give you paracetamol, take. Don't be too knowledgeable than your your health care giver. Share this content for more people to see. I will see you. Stay this week. Thank you for spending your time to join me here. God bless you.